All right. You probably heard enough about COVID, but let's call it what it is. A lot of people ended up getting it. And for some people, it seemed to be a non event. But research is showing, believe it or not, those that got COVID, there's an increased risk of heart disease. Why is that? We're going to get answers from our next guest.
He is Dr. John Pierce. He's the medical director at Preventative Diagnostic Center right here in Las Vegas, welcoming you back on the show. Dr. Pierce, let's talk all about this. Do you think there has been a lot of conversation, of course, around the effects of COVID on the heart? What are we seeing?
Well, COVID has done a lot of strange things. One of the issues is in some individuals, it's creating hypertension. They don't have any previous history of high blood pressure, and COVID has created that. And we're also seeing electrical abnormalities with it. There's a syndrome called POTS, postural orthostatic hypotension syndrome. And what happens is kind of people stand up and they get real dizzy, and it's their heart rate goes up. And we're not exactly sure the complete etiology or kind of why this is, but this is associated with COVID as well. And then when we talk about myocardial infarction or heart attack, there's been like a 63% increase in heart attack rate in people that have had COVID. And it makes sense when you understand how the virus actually attacks the body. It attacks the endothelium. The endothelium is the inside lining of the blood vessel. And if you have a plaque buildup, that inside lining of the blood vessel is covering that plaque, and it prevents it from rupturing. Well, if the virus attacks it and it weakens it, that allows that plaque to rupture much easier. And that starts the etiology of the heart attack, because the body now tries to repair where that plaque ruptured. And to do that, it forms a blood clot to heal that endothelium.
Yeah.
And then distally from that blood clot, that heart tissue will die unless you have immediate intervention. And the other thing that we see is, I think it was about a 75% increased risk of blood clots. And again, because the endothelium prevents blood clots from forming, when you weaken the endothelium, as this virus does, we see an uptick in the risk of blood clots as well.
Yeah, we've seen for sure. I mean, the COVID infection. There was the worries about the vaccination and possibly that adding to a smaller amount, but actually getting infected with COVID, the blood clotting really, really high. So, what are the signs then? Say you did have COVID and you're like, all right, well, I feel like mostly better, just a couple things here and there. Are there any signs before a heart attack that'd be like, wait a second, let me get this checked out?
Typically, there are no signs before a heart attack outside of maybe noticing that, a certain level of exertion that wasn't a problem before. Now I'm finding myself more short of breath. I'm sweating a little bit more. That's almost like you're doing a stress test, right? And you're starting to stress the heart muscle, and it's not being perfused as well. So it creates a greater degree of fatigue. So if you're doing normal activities that you've done before and you're finding that you're more and more fatigued, you may want to get in to see your doctor, because further testing may be appropriate.
Absolutely. This is kind of scary stuff, quite frankly. What about the scan that you offer, Preventative Diagnostic? Can this kind of give us any insight on these conditions?
Well, the insight that it would give is that we would see if there was a high calcium score, and that's correlated to the degree of coronary artery disease that you have. So if you have a calcium score of 0, pretty unlikely that you have any soft plaques in the coronary artery. So less likely that that endothelial damage would create a plaque rupture if there's no plaque there. Now, if you have a high degree of calcium score and a high plaque burden, that's where you have to be much greater concern.
Absolutely. So you'll do the scan. You'll also ask, have you had COVID before? And if so, maybe you can point them in the right direction.
In a lot of instances, we can see if they actually have a recent infection with COVID, because it has its own kind of pathology that we see in the lungs. There's this, it's called the ground glass appearance and infiltrates in the lungs. So we can tell. Yeah.
It's really, it's so interesting. I know you're doing a scan right now. Not just, there's a lot of people, families in particular. I know my wife has been very concerned about COVID entering the house. We've been fortunate, nothing in here yet. However, that said, we want to make sure our health is good. You want to make sure that couples can come in and make sure that they're doing all right with the scan. Tell us about your special.
Well, the special is we're offering 2 heart scans for $125, and this gives you that calcium score. Typically, those are $599 each.
Wow, it's a great deal. And it's a great
Good
having
deal,
you on.
doctor.
Of course. I mean, I wish we could just talk about sports. Talk about the Knights there, although depending on the game,
I
that can be
see
a
his
little
pin.
We got a game. So
We got a game, finally. Great to have you. Thanks for joining us.
Bye, Dr. Pierce.
All right, here's the deal. You and your loved one, you want to get a heart scan with a calcium score, you can get it for just $125 for both of you total. Usually it's $599 per person, so you're saving a whole bunch of money. Preventative Diagnostic Center, they're there on South Tenaya Way. You want to learn more, go to the website you see right there on your screen.